Welcome back. At least 10 people have died following an outbreak of diarrheal disease or gastrointestinal infection in the country. Diarrheal disease is a common and often highly infectious condition that affects the stomach and intestines. The Department of Health has urged South Africans to take extra precautionary measures and maintain proper hand hygiene. The department says since the outbreak of the disease, it has also seen an increase in the number of cholera cases. The department says a number of cases of people presenting with gastrointestinal symptoms have been reported in Hammanskraal, north of Pretoria, in the past few days. Gauteng health authorities say Jubilee Hospital has recorded the highest number of cases and fatalities so far. And we're joined now by the Gauteng Department of, the Gauteng Department of Health, also confirming the cholera outbreak in Hammanskraal, city of Tshwane. This comes after lab results of stool specimen in 19 people who presented at Jubilee District Hospital with symptoms of diarrhoea, stomach cramps and nausea, confirming that it is cholera since Monday last week. To date, 95 people from Kanana, Suurman, Majaneng, Greenfield, Carousel View and Sekampaneng have seen at the hospital with similar symptoms. The department says currently there are 37 people admitted at the hospital with cholera symptoms, and unfortunately 10 people have died. The 10 people that died include a 3-year-old and 9 adults. For more on this, we're joined by the Gauteng DA Shadow MEC for Health, Jack Bloom. A very good evening to you, Mr. Bloom, and thank you so much for speaking to us. So perhaps as I was reading this, it would be of interest as well to our viewers. I'm not sure if there's been a discussion around this. So the National Department of Health releasing a statement talking about an outbreak of gastrointestinal disease, and also saying that it's concerned about the increasing number of cholera cases. Is it one and the same thing, given the fact that it's being said that the symptoms are same, maybe not entirely identical?
Yes, I think cholera is a notifiable disease. So I think maybe the caution in identifying certain of these cases as cholera is because they haven't yet been, properly diagnosed in terms of laboratory confirmation. So I think we just, it could be a extension of the existing cholera outbreak that we've had. This first started off with people who travelled elsewhere and came back. And then about a month ago, it was quite clear that there were local cases, that it was being spread through the Yxke River, and it's very conceivable that now we have extra cases in Hammanskraal. And I think, look, the lesson is that we should be very cautious, whatever it is that's going around, and cholera is very serious indeed. The key thing is that people need to be identified and treated in good time. The treatment's actually very simple in terms of, a solution. You mustn't dehydrate, you mustn't lose salts and glucose. But the main thing is that identifying this and treating people in time. But the lesson as well, education. People must wash their hands. And I think the problem, of course, is that it's not piped water that's the problem. It's other sources of water, and people having baptisms in streams. That's where some of the cases are picked up. But look, awareness is absolutely critical. They need to do laboratory confirmation of what is cholera and what is not. But in any event, people need to seek treatment when their symptoms are severe.
And as you mentioned, the fact that it is fatal, and reports of both outbreaks, there have been deaths that have been reported. Now, the first cholera death was in February after the virus arrived in the country from Malawi, as mentioned. But I'm curious, in terms of this outbreak, is the infection a local transmission?
Well, we already saw that that it was a local transmission because they picked up cases of people who had no contact with whatsoever with foreigners, sorry, not with travellers or people who'd been overseas or otherwise who had left the country. So it's very clear that there is existing local transmission. As I said, there have been baptisms in streams, and people have taken in water, and that's where it's been spreading. So I think this is very serious, and Gauteng is the epicenter of this, and if we don't actually catch it here in time, it could spread to other provinces as well. So very definitely there is local transmission. People who've had no contact whatsoever with travellers from other countries, and I think all due cautions needs to be taken. But the key thing is contact tracing. I think everybody who is identified with cholera, we need to find out who they've been in contact with, because it can be spread, by food and food preparations. So contact tracing at this stage is extremely important. I hope that's being done in Hammanskraal, and I hope that they're doing laboratory tests to confirm whether it is actually cholera. That must certainly be the suspicion, but there have already been 10 deaths, and that's high. The last time we had a cholera outbreak in South Africa was in 2008 and 2009. There were 65 deaths in that outbreak and more than 12,000 cases. So it's serious. We need to intervene as soon as possible, and I think be on the alert for what could be a possible cholera case, diagnose it properly, treat it properly, and do contact tracing, who that person was in contact with, and anybody else in their family or contacts might have got it as well.
And I want to maybe just follow up on the point that you've made about the last outbreak. That case, I think the infections came from Zimbabwe. What lessons have been learnt then? You spoke about piped water not being the problem, but in terms of infrastructural improvements, are we creating an atmosphere where people actually can practice safe hygiene? Do they have access to reliable and clean water services? And in most cases, this also happens a great deal in informal settlements where some of the facilities are not available.
Well, absolutely. That's the problem, is that many people still do not have piped water, and that's exactly where the problem can occur. So the Hammanskraal area has a water problem, and I think the municipality, all the municipalities in Gauteng, in fact, need to be involved as part of the solution to this. And obviously, that's precisely the problem, because it's not an issue with piped water. It is an issue with people who have to get other sources of water, including rivers, and that's where it can certainly spread. And that's how it's been spreading so far, unfortunately.
These district response teams that the health department in Gauteng has dispatched, who is speaking of, do we know what exactly they do? Are they concentrated in particular areas? We are talking about Hammanskraal now as being the worst affected, but what are you hearing in how they're approaching how to deal with it? Is it the most populous areas of the province that they're targeting?
Well, the cases that we had previously were Alexandra and Diepsloot. Now a different part of the province seems to be heavily affected, and I think they need to have a rapid response team and, quick diagnosis, contact tracing, as I said before, and try and nip this in the bud. But, we really do have a very serious infrastructural problem, is that too many people do not have access to piped water, and that's a problem that needs to be alleviated as soon as possible. But we do have cholera cases. They are locally transmitted, and there seems to be a serious problem now in Hammanskraal, and I think the department's team should be out there and educating people and trying to cut the transmission route, because otherwise this really could spread quite alarmingly, unfortunately.
All right, thank you so much for speaking to us, much appreciated. That's the DA's Shadow Health MEC in Gauteng, Jack Bloom. Now,